my name is Dr. Katinka and I am author of Taming the Beast, A Guide to Conquering Fibromyalgia. And I want to talk to you a little bit about what we do in our clinic today, because I often have a question, what do you do that's so different? I've tried tons of chiropractic, I've done acupuncture, I've seen pain management specialists, I've seen all these doctors, and so I just want to walk you through kind of what the process is in our clinic. I am very passionate about treating fibromyalgia, especially very severe cases. I always call it a life-robbing disease, and it really is, because it takes so much joy out of your life. So the first thing that we do that is different is we treat fibromyalgia as a nervous system condition. I truly believe that a lot of fibromyalgia is caused by malfunction of the nervous system. And when I say the nervous system, let me just grab my spine. I mean this part of the brain right here, which is your automatic or autonomic nervous system. Everything that happens in your body that you don't have to think about. For example, if you go to sleep at night, your heart is going to beat and your blood pressure will be regulated. Your body will be producing hormones. You don't have to think about this. This goes on every second of the day automatically. We work with this part of the spine, and the injury that causes this to be misaligned is very often a whiplash injury. So my ideal patient is the patient that had a whiplash injury sometime in their past, usually many years ago, or some kind of neck injury, and nobody ever linked it with their fibromyalgia. But if you have chronic neck pain, disc pain, you may have had surgery together with your fibromyalgia, usually you're a good candidate for care. So let's talk about the nervous system part. I want you to think of your automatic nervous system as a seesaw. So here's your seesaw, and it's divided into two parts. It's sympathetic and parasympathetic, and don't get caught up in the terms. What I want you to remember is that sympathetic is fight or flight, and parasympathetic is rest and digest. So fight or flight is the nervous system that will kick in. Let's say you're walking in the woods and you see a mama bear with a cub and you are scared. That nervous system is going to kick in. So right when that happens, just think through what your body is going through. You're scared, your muscles are tense, you're ready to fight, you're anxious, your adrenaline is pumping, and there's no way that you can sit down, lay down, take a nap, eat a hamburger. That's just not going to happen. So this system is designed to work like a seesaw. If one's up, the other has to be down. Both cannot be up at the same time. So they work like this. You can also think of your car. You have gas and you have brake, and you cannot push both down. It just simply doesn't work. So sympathetic is fight or flight. That's, for example, increased anxiety, increased blood pressure, increased muscle tension, and increased pain. This, in a nutshell, is where fibromyalgia people are stuck all the time, on sympathetic. That means that this nervous system isn't functioning. Parasympathetic, rest and digest, meaning you cannot sleep at night. But you're exhausted all the time because your adrenal glands are pumping adrenaline till they run out and go kaput. So you're tired but can't sleep. You have digestive issues. Perhaps you've been diagnosed with IBS or Crohn's disease. Medically, they always try to treat that separately when that is part of the overall picture. Healing goes in this group, so you're not going to heal as well. Your immune system. People with fibromyalgia will often go into autoimmune conditions, and sex also goes into this group, so your sex drive will usually be way down. So that is the nervous system portion of it. I discuss it more extensively in my book, and let me go show you my clinic and have you meet some of my patients.